Hello, my name is Dr. Tony Jimenez. I'm the founder and chief medical officer of Hope for Cancer Treatment Centers. Today we're here with Dr. Raul at
Hi,
our
Dr. Tony.
Cancun Treatment Centers. Welcome, Dr. Raul.
Thanks, Dr. Tony.
Yeah.
Thanks for having me here today.
Yeah, it's been a blessing having you as part of our team here at the Hope for Cancer Cancun facility. Let's start with you giving us a little details on your educational background.
Yeah, sure. So first of all, I'm from Mexico City. I'm originally from there, so I did all my medical background there mostly. So I was in one of the two main med schools in Mexico City. Is Politécnico Nacional, and actually my med school they teach homeopathy. So I was in that med school. It's national school for medicine and homeopathy in Mexico City. So I was there for 5 years. Then after finish the 5 years of med school, I went to one of the main big hospitals in Mexico City to have my medical internship. So it was 1 year doing all the activities in the hospital, right? So all these like pediatrician, gynecologist, so all these things, surgery, all these things that you do in the first year. Then I went to have 1 year of social service in one community, which is not far from Mexico City, like 5 hours driving, but it's like in the mountains. So it was like hard for me to be there. But it's just 1 year. So after that, I went to Mexico City, back to the city to start working. Then I was called to Hope for Cancer, but I was in the Tijuana clinic first. So that's why when we met and when we started working together in the Tijuana hospital.
Yeah, you started at our Tijuana Treatment Center, right? And then after how many years were you in Tijuana?
Almost three, like
Almost
2.5, 2 and 7 months, and then they transferred me here to Cancun.
And then here in Cancun, you've been with us how long now?
It's going to be about 3 years.
3 years.
Yeah,
Okay,
3
so
years.
about 6 years in total. Right?
Exactly. Yeah.
Going back, what was your motive or your incentive to become a doctor in the first place? Did you know you wanted to be a doctor from when you were little, or something happened?
I think that it was during elementary school because I used to be like a very sick boy. So I was always all the time in the hospitals, like with a lot of allergic reactions and asthma and skin reactions. I was very, very allergic. So I spent a lot of time in the hospital, but I really enjoyed my time in the hospital being a kid. Really, it was fun for me. And of course, it's not completely fun, but it was like fun being out of school and then just going to be in the hospital. They do tests on you. So for me, it wasn't really that scary, but I was all the time in the hospital. So I think that I started to have something was calling me since that moment when I was a kid. Then I have a couple of families that are family members that are doctors. So they just, I don't know, it just feels that I just want to become a doctor. And then during all these years when I was a kid, my parents, they also liked a lot of homeopathy. So they always take me to this homeopathic doctor. And it was for me amazing how he can cure me just with some drops and you take this in water and that's it. It was no injections, no pills, nothing like that, nothing going to the hospital. So I think that since that moment, I knew that this thing was different. So I want to know more. And I think that just both things come together and then I became a doctor.
Wow, awesome. So now I see the connection and why maybe when we found you, when we were blessed to find you and invite you to our Tijuana Center, jumping into the integrative oncology field, was that difficult? It seems like...
Not really,
Not
because in homeopathy, for example, we take a lot of in consideration also the emotions and how the patient feels at that moment, right? So it's also something to consider when you prescribe the medication in homeopathy. You need to know the terrain of the patients, the moment that they are now, the emotional state that they are, because you can have different combining treatments differently, right? So it was not hard for me to try to like change this to the alternative way, let's say. So I think it was more easy for me to try to understand that big connection between the alternative and the other integrative management for oncology.
And I definitely have seen you because we've worked together a lot throughout the years, and I see your interaction with patient and how you drive the questions, right? It's a different mindset than being strictly trained as a conventional doctor, right? Because you don't take the emotions and relationships and things like that into consideration.
Yeah, I think that you need to to dig more a little bit in the patient sometimes, and you for sure need to like stand on what point you are to manage patients, right? Where you can start to ask questions, when you can use, it's assessing also the patient, not only like see paper and the cases and numbers. It's like focusing on the patient and say, okay, what he did or she needs at this moment right now, right? So
very personalized and individualized,
yeah.
right? Yes. Changing gears a little bit, Dr. Raul.
Yeah.
Working in oncology, integrative oncology, is difficult for us as physicians, as healers, right? It can take a toll on our emotions, and because we love our patients.
Yeah.
So, what do you do for fun here in Cancun? You moved from Tijuana. Do you like
Yeah.
Cancun?
Yeah, for sure. Actually, I moved here because I really love the beach. So one of the main things that I do when I'm off the clinic and I have a little off time, I'm going to the beach. I really do love to swim, going to the beach, the sun. So I think one of the major things that why I moved here. Also because it's close to Mexico City, so my family is there, so we can
Okay.
go and visit each other. So one of these reasons that I came here. Tijuana was also a very good experience, living there, having the experience to work in the clinic. But here, I think is a nicer area, and I do like to live here. So just going to the beach, spend out, hanging out with some friends. I don't know, cinema is also one of my things that I do when I am at home. They're watching movies, go to the cinema. I read a lot. I do puzzles, so things like that. Video games.
Okay.
Yeah.
I also heard that you're a good dancer. Is that right?
Yeah, kind of.
Not have I only heard, I've seen you.
I do like to dance a lot, and I have friends that just follow me so we can dance all night long. So, yeah.
Excellent, excellent. Any final words of advice that you have for our viewers, whether they're in cancer situation now healing, whether they're NED, no evidence of disease and remission, or those of you that might be afraid to have cancer because
Yeah.
we know that the incidence of cancer is increasing and the world is more toxic. So many factors, right, that is increasing the incidence of cancer. What would you say to all of our viewers?
Well, first of all, I think that, and I think you mentioned already, is that fear. The fear that and the unawareness of the disease at the moment, right? So I think that the main thing that I can say is that don't don't have fear of all the outcome that can happen. Just be focused on what you can do, and get help of the others that you are with you, even your family members, and then with all the support that you have at home, you can look for more or better options. So don't be fear, and just be hopeful. And there is always options for patients to treat, right? Not only the conventional way to do it. I think that would be one of the things that I can mention to patients.
All right. Well, thank you so much, Doctor. What a pleasure. And
Thanks for
I look
having me.
forward
I'm
to
so
so many, many more years of working together.
Yeah, me too, Dr. Tony.
Thank you.